Lumbar puncture, indications and procedure. Prepared by Dr. Manal Mosa Ibrahim. Session objectives. Discuss the indications and contraindications for lumbar puncture, LP. Review the procedure of LP. Present techniques to minimize post-LP headache. Indications for lumbar puncture. Diagnosis of central nervous system, CNS, infection. Diagnosis of subarachnoid hemorrhage, SAH. Evaluation and diagnosis of inflammatory SNES processes. Infusion of anesthetic, chemotherapy, or contrast agents into the spinal canal. Treatment of intracranial hypertension. 15% of seizures result in injury or death. Head contusions and lacerations common. Mortality rates. 1.2% of all seizures. 3 to 26% in SE. Mortality rate 10 times higher in adults versus children. SE mortality highest with hypoxic or ischemic insult. De Lorenzo et al. Neurology 1996 to 1029. Jacqueline Neurophysiol 1995 12 to 316. Epilepsy 1992 33 supple 4, S15. Hauser. Neurology 1990 40 supple 2, 9. Kirby and Sadler. Epilepsy 1995 36 25. Terence et al. Unneural 1981 9 to 458. Contraindications: skin infection near site of LP. Alteration of intracranial pressure due to cerebral mass. Uncorrected coagulopathy. Acute spinal cord trauma. Lumbar puncture procedure. Equipment: 18G or 20G sterile spinal needle with stylet. 22G needle for children. 3-way stopcock. Manometer. Small adhesive bandage. Sterile gloves for the physician. Sterile gloves for the nurse. Sterile gauze pad. Equipment: cont. Antiseptic solution, for example iodine. 25G sterile needle for injecting anesthetic. 3 sterile collection tubes with stoppers. Overbed table. 3 ml syringe for local anesthetic. Laboratory request forms and laboratory biohazard transport bag. Labels and light source. Disposable lumbar puncture trays contain most of the needed sterile equipment. Preparation: 1. Determine whether written consent for the procedure has been obtained. 2. Explain the procedure to the patient. 3. Instruct the patient to void before the procedure. Performance: 1. The patient is positioned on lateral recumbent position or sitting upright position. 2. Small pillow may be placed under the patient's head. 3. A pillow may be placed between the legs. 4. The patient is encouraged to relax and is instructed to breathe normally. 5. The physician cleanses the puncture site with an antiseptic solution and drapes the site. Technique: lateral recumbent position. Sitting upright. Positioning: correct, incorrect. Skin preparation: overlying skin cleaned with povidone iodine. Sterile drape placed with an opening over the LS. Performance: cont. 6. The physician injects local anesthetic to numb the puncture site. 7. The physician inserts a spinal needle into the subarachnoid space through the third and fourth and fifth lumbar interspace. 8. A specimen of CSF is removed and usually collected in 3 test tubes, labeled in order of collection. 9. A pressure reading may be obtained. 10. The needle is withdrawn. Performance: cont. 11. The physician applies a small dressing to the puncture site. 12. The tubes of CSF are sent to the laboratory immediately. 13. Instruct the patient to lie prone for 2 to 3 hours. 14. Monitor the patient for complications of lumbar puncture. 15. Notify physician if complications occur. 16. Encourage increased fluid intake. 17. Documentation. Record the initiation and completion of the procedure. Patient's response. Administration of drugs. Number of specimen tubes collected. Time of transport to the laboratory. Specimen color, and any other characteristics. Positioning, key to success. Fetal position with neck, back, and limbs held in flexion. Lower lumbar spine flexed with back perfectly perpendicular to edge of bed. Hips and legs should be parallel to each other and perpendicular to table. Spinal needle insertion. Local anesthesia infiltrated. 20 or 22 gauge spinal needle with stylet. Advance spinal needle slowly, angling slightly toward the head. Flat surface of bevel of needle positioned to face patient's flanks. 15% of seizures result in injury or death. Head contusions and lacerations common. Mortality rates. 1.2% of all seizures. 3 to 26% in SE. Mortality rate 10 times higher in adults versus children. SE mortality highest with hypoxic or ischemic insult. De Lorenzo et al. Neurology 1996 to 1029. Jacqueline Neurophysiol 1995 12 to 316. Epilepsy 1992 33 supple 4, S15. Hauser. Neurology 1990 40 supple 2, 9. Kirby and Sadler. Epilepsy 1995 3625. Terrence et al. Unneural 1981 9 to 458. Post-LP headache. Etiology: prolonged leakage of cerebrospinal fluid due to delayed closure of dural defect. Low CSF pressure. Incidence 1 to 70%. Contributing factors: diameter of needle, shape of needle, diagnostic versus spinal anesthesia. Minimizing post-LP headache. Techniques: needle choice, number of attempts, reinsertion of stylet, bed rest after procedure.